Hi, I'm Nicholas Dwork, and today we're going to be discussing the noise of MRI. Here's an axial slice of a brain simulated with the brain-web interface, and this is a pristine image. There is no noise in this image. Here it is with noise, and if we put these side by side, you see how much noise can degrade an image. So where does this noise come from? Let's go back to talking about our droplet of water. Recall that each hydrogen atom is a little magnet. It has a magnetic vector associated with it, and in general, in normal everyday life, the magnetic vectors all point in opposite directions so that there's no net magnetic vector to any little droplet of water. However, if you put this droplet in a large magnetic field, such as that generated by the magnetic resonance imaging machine, then the magnetic vectors of the hydrogen atoms ever so slightly align with the external magnetic field, and we are able to see the resulting net magnetic vector. This would be the case at 0 degrees Kelvin and everything were frozen. However, at any temperature above that, like the temperature of the human body, particles move. Here, yellow dots are indicating the same particles, and the blue lines are showing the random motions of these particles. So if we impose a grid, and we call each of the squares of this grid a pixel in our image, we're seeing that the same particle enters into many different pixels. And also, if we isolate just one pixel, we're seeing that many particles come and go into this little pixel, so we're averaging different of these magnetic vectors. This causes the noise of MRI. So how can we reduce the noise and get a good image out? There are several ways to do this, and we'll discuss 3. We can change the strength of the main magnet, we can change the voxel size, and we could change the scan time. So here, recall that with the presence of an external magnetic field, the magnetic vectors of each of the hydrogen atoms ever so slightly align with that external magnetic field. Here I'm drawing in blue just the net magnetic vector. And if we increase the strength of the external magnetic field, then we also increase the amount of alignment of the magnetic vectors from the hydrogen atoms, so we get a larger magnetic vector for our voxel. So how do you go about increasing the size of the main magnetic field? Well, you have to purchase a new MRI machine. Here's a Philips Ingenia Ambition 1.5 Tesla machine. Here's a Philips MR7700 3.0 Tesla machine. And here's a recently developed Siemens Magneton 7 Tesla machine. This is the limit for current clinical MRI machines. They don't really go larger than this for clinical MRI. And there are trade-offs to increasing the strength of the main magnetic field. Yes, you get a higher signal-to-noise ratio, but for example, you'll get less magnetic field homogeneity across the image, which can cause other artifacts. What else can we do? Going back to this picture, I'm going to replace this picture of multiple hydrogen atoms with just a single net magnetic vector. And then we can increase the size of the voxels. Increasing the size averages the net magnetic vector over more of these hydrogen atoms, and we get a larger net magnetic vector. This is the consequence of doing so. On the left is a high-resolution image of an ankle, and on the right is a low-resolution image of an ankle. Now, the image on the right has a higher signal-to-noise ratio. There's less noise in the image on the right. However, it's not as diagnostic, and so there's a trade-off to be made between the amount of noise in an image and the resolution of the image. Finally, longer scan times equate to less noise. A simple way to increase the scan time is just to make many images and average them together. This is often included as a parameter on the MRI machine called NEX, which stands for number of excitations. While this can reduce noise, it also increases the length of the scan, so the number of patients that can be seen by any scanner gets reduced if you use this technique often. Also, it provides more of an opportunity for motion. So here's an example of an image, an axial slice of a brain where the patient moved during the scan. So increasing the scan time is especially problematic for patients that struggle to remain still, like young pediatric patients, fetuses, or patients in pain. Okay, so we've seen that noise can corrupt image quality, and we've seen that there are multiple methods for reducing noise in images, like increasing the strength of the main magnet, increasing the pixel size, and increasing the scan time, but there are trade-offs between each of these approaches. Thank you for your attention.